Biggest thing, just the short time frame that you're outside can cause severe injury to your skin, and we're often forgetting just to cover our nose and cheeks and face and ears. Those are probably your high contact points that are getting directly hit from the outside weather, where we typically put our winter jacket on and we're fine. A lot of times we put gloves on, but at the same time we may forget our gloves, and we got to cover our skin and protect it from the cold air. Uh, in a short time frame, you can develop nice red hands and early signs of frostbite, and making discomfort to the skin. Early warning signs of just very simple frostbite, maybe the red skin, pain to the areas. You definitely want to immediately seek shelter, get into a warm area, but be careful at the same time, because the numbness could definitely settle in, that you're not directing hot heat to the areas and causing more damage to the skin and burns to the skin. So if somebody else could at least evaluate the warmth that you're getting exposed to. Typically you just want warm air, blankets, not a direct heat source like a heating pad or a fire source. Then if there's further concerns where you're not warming up like typical, after maybe 15, 20 minutes and the coloration of the skin's coming back, you may want to seek urgent care or in the MedPoint evaluation just to make sure everything's okay. In more severe cases, it would be more blistering. In longer cases, discoloration of the skin where it's turning black. That would definitely be an emergency room evaluation. I mean, a lot of it depends how cold it is, how windy it is, and if you also have wet clothing on. So if you've been playing in the snow, your hands are wet, it's windy out, you can be out for 10 or 15 minutes. And if it's cold enough, you're going to have frostbite compared to if it's quite a bit warmer in the 30s or 40s. The younger you are, less aware of your environment. You just kind of go outside and play. You don't really care about your jacket. And they sometimes don't tell us, and especially more the infant stages where they might be, in their typical room at night, and you shut the door and that room often gets colder. And when we start hitting 0 degrees and below, that room is a lot colder than normal. So keeping aware of that. The older population, you got different health problems, confusion, diabetes for a high example of numbness and tingling extremities, and they just don't realize how cold it is outside before it's too late. And plus the vascular issues in the older population and decreased circulation. Once again, you're going to expose to more complications of frostbite. The biggest thing is really limit your outside time, and if you can, avoid going outside or travel during that time. Isolate yourself inside the doors where it's nice and warm and safe. The more you're outside the house and into the weather, the more likelihood something's going to happen.